Welcome to our In Focus discussion tonight on PTSD Awareness Day. The condition has been called shell shock, nostalgia, soldier's heart, and it has been written about for centuries. But it wasn't until the 1980s when the American Psychiatric Association added the condition to its diagnostic manual of mental disorders that PTSD finally received some public awareness. It no longer focuses solely on the military. The disorder is a result of traumatic stress, and people with the disorder may experience fear, anxiety, flashbacks, nightmares, and suicidal thoughts. This Sunday, June 27th, is National PTSD Awareness Day, so tonight we will hear from clinicians who work with people who have experienced different forms of trauma. Kicking off our discussion tonight is Dr. Harrison Weinstein. He is a clinical psychologist with the George E. Wallen VA Medical Center. And Dr. Weinstein, thank you so much for joining us tonight. It's a pleasure to have you.
Thank you for having me, Rosie, and for drawing attention to PTSD Awareness Day.
Now, Dr. Weinstein, I'd like to start with your personal definition of PTSD. I know you all have a medical definition of it. How do you look at PTSD?
Yeah, so PTSD is a specific reaction following a traumatic event or multiple traumatic events. What we see is that people have intrusion symptoms, so unwanted thoughts or nightmares. They might have some reactivity symptoms, being on guard, on edge. There's avoidant symptoms, so maybe avoiding reminders of what happened, maybe emotional distancing and isolating. And we also see what we call an alteration of cognitions and moods, which just means a change in thinking. All of this is a normal response to trauma. And typically following an event, we see symptoms improve over time. So you follow up with somebody in a month, 6 months, a year, those symptoms just get better. What PTSD is when those symptoms are either persisting or they're worsening over time. So it's a normal response to trauma with a failure of natural recovery.
It's so complex, and I'm so glad that as we go on, as the years go on, we're just finding more ways to help treat it. Dr. Weinstein, help us understand, how far back in the military does PTSD go?
I think it even goes beyond the military, where I think that PTSD has been experienced by people as long as people have been experiencing traumatic events. So it's probably throughout our entire species, and it's part of our evolution. We see it written about time and time again. You go back to the Iliad, the Odyssey, Shakespeare, Dickens, and you can find accounts of PTSD. It gets different names over and over again. So a lot of those are tied to different military conflicts: shell shock, battle fatigue, combat fatigue, soldier's heart. It really wasn't until more recently when it pulled away a little bit from the military as a diagnosis. Different groups played a role in that. So Holocaust survivor advocacy groups, civil rights advocates, feminist groups, kind of came together along with veterans and said these different groups are experiencing similar symptoms following traumatic events. And it really pulled it away from combat to trauma. And that landed us on PTSD, where we are today.
That is so fascinating. Dr. Weinstein, what are some of the warning signs or red flags that someone should look for if they themselves think that they may be suffering from PTSD?
Yeah, so following an event, again, these symptoms are normal. So we always want people to utilize their social supports, take care of themselves in however they do. We also don't want them to panic about normal symptoms. So the things to look out for are certainly if those symptoms are continuing or if they're worsening over time. Certainly severe symptoms, we want people to seek help right away. If somebody is having thoughts of suicide, call 911, go to any hospital. There's also the suicide hotline, which is 1-800-273-TALK. Other than that, I think the main symptoms of PTSD, the unique features, are especially those re-experiencing symptoms. Thinking about it when you don't want to, being haunted by it, you can't shake it out of your head. The biggest thing that we don't want people to do is to isolate or to go it alone. We want them to stay engaged, stay connected, and live their lives.
So what does treatment look like, and how successful can it be?
Yeah, so this is the most important message is, well, PTSD is a very serious condition, and I view untreated PTSD as a chronic condition, the good news is that we can really help PTSD. The clinical practice guidelines make it really clear that trauma-focused psychotherapies are the recommended treatment for PTSD. We have a few: cognitive processing therapy, prolonged exposure, EMDR, that are treatments that are very trauma-focused. You work one-on-one with a therapist, typically 8 to 15 sessions, and we expect that people who engage in these treatments get better and stay better.
I sure hope so. Dr. Weinstein, we have about 1 minute left. Final words. What would you like to leave our viewers with, or how would you like them to reflect as they're thinking about PTSD Awareness Day?
Yeah, I think that the big message I want to give is, again, that PTSD is serious yet treatable. And I also I think it needs to be something that we treat with dignity and respect. There can sometimes be a distance between that person over there has PTSD, but these are our family, our friends, our neighbors, and we want to support them in every way that we can. I also want to dispel some myths that people sometimes have about PTSD, that
Please.
These people are weak or broken or dangerous, and none of those—
Or untreatable.
Or untreatable.
Right.
And none of those things are true. I work with incredibly strong people every day, and incredibly resilient people. I think that's the message we want to give across, is people are resilient and experience difficult things, but also overcome very difficult things.
Thank you so much for having this conversation with us. You've been hearing from Dr. Harrison Weinstein. He is a clinical psychologist with the George E. Wallen VA Medical Center. And Dr. Weinstein, thank you so much for making time to be here tonight and helping educate us on this important topic.
Thank you, Rosie.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on PTSD Awareness Day. PTSD is not confined to just our military, and in this day and age, other professions also experience trauma on a regular basis. Joining us next to talk about PTSD and first responders is Tia White. She is a licensed clinical social worker and director of research and operations with Previdence, a company specializing in public safe mental health. And Tia, thank you so much for being with us tonight. We'd like to start out with asking each of our guests how they view and define PTSD. So tell us about how you interpret PTSD.
Sure. First, I just want to thank you so much for recognizing that our public safety, our first responders also struggle with this. This is something that we're very passionate about. I spend a lot of years studying it and working with these guys and gals. The way that I look at public safety or at PTSD is that it's when our brains are just too overwhelmed with what we're trying to handle. And when we start seeing symptoms of PTSD, the way Dr. Weinstein talked about it, that means we're already overwhelmed. So it's too late at that point, right? We're already hit that point of overwhelmed. And so we want to make sure that we prevent that point. We want to make sure that we're taking care of ourselves so that we can avoid those symptoms.
Right, there's so much to internalize there. The thoughts, the emotions, and the memories as well.
That's right.
So Tia, how do you look at the similarities and the differences between what first responders, paramedics, police, firefighters, what they all experience? What are some of the similarities and differences there?
So they all of them, including dispatchers, right? They all face things and see things, experience things every day that most of us can't even imagine. And they all each play a little piece of that, right? So their job descriptions, their actual job duties might be a little different, but they're all facing and seeing unimaginable, terrible things all the time.
Are you familiar with the term vicarious trauma?
That's right, yeah.
Tell us a little bit about what vicarious trauma is.
That's when you're hearing and you're experiencing it from the outside, right? And it traumatizes you and it affects you. So a lot of us in America experienced this with 9/11. We watched the towers fall, and because of that, we experienced a vicarious trauma. It was awful, right?
Are there any unique challenges that dispatchers may deal with because they're not exactly there seeing the trauma unfold in front of their eyes, but they're hearing it? And sometimes they stay on the call with these people in the most darkest moments of their life.
Yeah. You nailed it. Our dispatchers are the first to the front line. They get the phone call, and through the screams and the cries, they have to try to figure out what's going on and what problems and how to solve it and how to help them. And then all of a sudden the call ends. and they don't know what happened. And
they don't get that closure.
No, they rarely ever know what the results were. And sometimes, a lot of times, they're on the call through the whole thing, like with the officers or with the firefighters and the medics, but they can't help. How hard is that to be able to not reach out and give assistance the way that they would like to?
Yeah, that's so hard, and I can only imagine how often they go through that because of the volume of calls that they deal with every single day. Do we have any idea how many people suffer from PTSD, and out of that number, how many may face suicidal ideations? Yeah, absolutely. So I shouldn't say absolutely because it's not completely accurate. There is not a lot of research in first responders' mental health, unfortunately. It's just not there. It's very new. But what nationally they've found is they're saying about 30% of our first responders are experiencing PTSD. With the research that we've done, we are finding really in Utah about 50% of our public safety is experiencing PTSD. And that could be an underrepresentation because some people may not even know that they're dealing with it or come forward with it.
That's right. Yeah, they may not be direct or too scared or lots of reasons. In terms of suicidal, being suicidal is another step further of PTSD. And the way that we look at that is my brain is overwhelmed, it's flooded, and I don't know what to do, right? So we're already exhausted from our PTSD, and now we don't know what else to do, and this is the only thing I can see. I just need a way out, right? There's so much pain. And there's no good numbers, because they just haven't been done for first responders, for public safety, in terms of suicidal. But I can tell you that in Utah, from the numbers that we've been able to collect, we anticipate that 10% of our Utah public safety are actively suicidal.
Oh my gosh.
And I've worked with recent departments that are 30% of their departments are actively suicidal. That means that our officers and our first responder, medics and our firefighters, they are going out to try to help other people while inside their own heads, they are just trying to stay alive.
Well, that's the thing. They're always busy helping other people. When do they take time to help and heal themselves, right?
Right.
Tia, we have about less than a minute left.
Great.
Tell us about what treatment looks like. What resources are available for our first responders who may be suffering?
This is simple. It's scarce. It's heartbreaking. There's very little. With first responders, they require a special kind of trauma treatment to be effective, and culture. The therapists have to be trained in culture of a first responder to be able to connect with them and to trust it. And it's so rare and it's so hard. So we try to teach them how to have peer supports. We try to have them work with the CISM team of Utah to do debriefs and just try to access whatever resources that we can. But it's very difficult. It's very unfortunate. We just don't have what we need for them.
I'm glad there is somewhere to turn in the beginning, and I feel like as we continue with this public awareness and education, hopefully more will emerge as far as like funding and peer support stepping up and whatnot. Thank you so much for having this conversation with us. You've been hearing from Tia White, a licensed clinical social worker and director of research and operations with Previdence. And Tia, thank you so much for being here with us tonight and helping us understand this.
Thank you.
We'll be right back. Welcome to our third and final In Focus discussion tonight on PTSD Awareness Day. Rounding out our conversation tonight live via Zoom is Debbie Comstock. She is a board member for the Utah Domestic Violence Coalition, here to talk about the trauma the domestic violence and sexual assault survivors face. And Debbie, thank you so much for joining us on the show tonight. Let's start our conversation with, how do you view PTSD for your clients?
Well, when people finally get it to me with PTSD, they have often dealt with really some debilitating conditions for a while and often wonder what is wrong with them. Why are they not functioning well? Why are they not able to be in satisfying relationships, or why do they still get into relationships that end up not being satisfying or healthy?
Now, you've heard of some of the challenges associated with PTSD that the military and our first responders face. So how is trauma for survivors of domestic violence and sexual assault similar and different?
Well, I have to tell you that first, I'm really struck by the conversation tonight, how common our language is. As I'm listening to them describe symptoms, I'm thinking, yep, that's exactly what I see. That's exactly what I hear. And we finally have some common language. Some of the ways that things are different for domestic violence victims is that this is still a trauma response, but it is in response to a situation with a person that they should have, hopefully, have had a satisfying and a trusting relationship with. And that's probably one of the most difficult parts for them to deal with.
Deb, can you share with us the most current numbers that you have on domestic violence and sexual assault cases?
Sure. In Utah, we know that 1 in 3 women will experience interpersonal violence, and even and that is a rate higher than the national average. We know that when it comes to sexual assault, that 1 in 6 women will report sexual, or 1 in 3 women will report sexual assault, but 1 in 6 women will report having been raped.
Those are staggering numbers. Deb, how can the symptoms of a survivor's PTSD manifest?
In many of the ways that you've already kind of heard tonight. Other things I may hear involve things like insomnia, much in the way of anxiety, panic attacks, but even things like poor concentration or excessively lethargic. And I've even seen it be expressed in actually parts of body shutting down and losing some mobility, just really shutting down.
And I think what we're learning tonight is that trauma may be on a spectrum. There may be different ways to experience trauma, but those symptoms of PTSD can be so similar. What are some of the challenges that domestic violence and sexual assault survivors face when they're trying to seek help?
You know, I think one of the first things they face is actually coming to grips that maybe they are a victim. I see so many which become apparent to me that they are victims, but they don't see themselves that way. And that is a journey of self-discovery to some degree. So once they've kind of come to that determination, then will they be believed? Will the people that care about them support them and believe them? And that's probably one of the biggest fears they have. What will happen if I disclose? What will happen to my children? What will happen to my life? Will I be safe? So that's some of the things that might be a little bit different with a domestic violence victim.
Right, and I think a part of that healing journey is to empower those survivors again to believe in themselves, believe that there is a light at the end of the tunnel, just like some of the things that you had described. What does treatment look like for these survivors, and how successful can it be?
Well, I actually have a lot of hope for treatment. As you've heard some things mentioned tonight, for domestic violence survivors in particular, some of it starts out with maybe a little bit more concrete support, like things like safety planning or sheltering to get their immediate safety needs met. And when those can be met, then some of the other things can be addressed. And as you heard mentioned tonight, there are several evidence-based approaches. As a clinician, I get really excited about thinking about the evidence-based approaches like EMDR or seeking safety, which are all approaches that work very well therapeutically with victims of domestic violence and sexual assault.
Debbie, about 1 minute left. Final words. What would you like to leave our viewers with tonight as they're thinking about PTSD as well as survivors of domestic violence and sexual assault?
I think what I'd like to leave with them is that domestic violence is everybody's business. It impacts people far more than we know because we don't talk about it enough. And even if you don't feel like it's something that you can deal with yourself, if you can get involved more at the local level, you can find ways to be involved in an area that you're comfortable with in terms of knowing how to help with shelters, in knowing how to help people find safety, or being friends to people and helping them know that they're cared about.
Well said. You've been hearing from Debbie Comstock, board member for the Utah Domestic Violence Coalition. And Debbie, thank you so much for joining us tonight to raise awareness about this topic.
Thank you. Thank you for inviting me.